name is Senior Chief Hospital Corpsman Mike Langley. I work for Marine Corps Systems Command in Quantico, Virginia, and I'm the AMOL Class 8 manager for the Marine Corps.
You have them down, you have to take a knee. And you guys have done this before, so just load in as I talk through it.
Today, the doctors, corpsmen, and nurses from Alpha Surgical Company with 1st Medical Battalion are training with the new mobile trauma bay. These folks are deploying forward to Operation Enduring Freedom at the end of the month of October. Here in just a few weeks, this is their MADX field training, and they are now actually going through drills in tactical situations, moving weighted mannequins and patients to get a real-world idea of what it's like to move patients in and out of the mobile trauma bay and all the challenges that are involved with that.
So into the shoulders. 1, 2, 3.
You gotta understand, as soon as you walk out that bay, it's
move.
The reason this training is so critical is because right now the way distributive operations are taking place in the fight, Marines are getting injured very far forward, and the medevac times are a critical issue, and we're trying to move away from the theory of the golden hour being the standard to get that patient to some critical trauma care, and we're trying to set that standard at what we're calling the platinum 10 to 15 minutes. We're finding that if we can get the warriors seen by the proper medical care very far forward early on, they have a whole lot greater chance of survival than they normally would. I think the training is going very well. It's going to give them a real aspect of some of the things they have to deal with very far forward, specifically the communication factor, taking charge of a scene, managing the scene and making sure that not too much confusion takes place, not letting the fog of war get the best of them while they're out there moving these patients around, and being able to actually train Marines and sailors who have never done this once they're out there to be their litter bearers, to move the patients into the mobile trauma bay and to prepare them for medical evacuation.
This is the drug cabinet. What's in the trauma lid? Okay, we had 1, 2, and 3. The lid.
This is the first training that's ever been done. The mobile trauma bay is a brand new unit that's rolling forward right now. So this training has not existed before, the specific things that are going on behind me. The field training that the medical battalion does happens all the time. These folks, they drill and they drill and they drill some more on all the medical situations to turn it into muscle memory, so when it happens for real on the battlefield, they know how to react instinctively. We have, just like in the Marine Corps, we have 18, 19, 20-year-old folks out there doing miraculous things with the Marines that get injured. And training's going well. We are letting them enjoy or letting them deal with kind of the situations that come up on the battlefield. So it makes it a little hard on them, but it's better. It makes them better for it. It's better they learn it now and make the mistakes here in garrison than it is out there on the battlefield when somebody could get hurt. The most trauma training that we can get these young Marines, or these young sailors, these young corpsmen, the young nurses, and the doctors, no matter what their experience level, but the more trauma training we can get them as a group, the better off they will be in combat, point blank.